Heaton Sperling. If you see any other problems, do give us a call at star or pound 690 on your cell.
Katie, thank you very much. You know, this past weekend, at least 35,000 Venezuelans rushed across the border into Colombia in search of basic food and medicine. The border had been closed for nearly a year as part of Venezuelan government policy. An economic collapse in Venezuela, fueled largely by low oil prices, means that grocery store shelves are empty. Citizens are forced to wait in days-long lines to get food and other basics. The military has taken control of food distribution, key ports as well, in an effort to ensure that food reaches the population. But so far, it doesn't seem to be working. Venezuelans living here in the Metro Vancouver area have been sending care packages with dried foods and other goods to their families back home. Laura Aveledo is a member of the local group Stand Up for Venezuela. She's originally from Venezuela, and she's here with us now in studio. Thank you so much for coming in.
Thank you for having me, Gloria.
You know, how difficult has it been for you and your family to get basic medicine? I mean, what are you hearing from them?
Well, you talk to them every day, and it's the same thing every day. They complain of the hard time and the difficulties that they are having every single day to buy not only food, medication, any kind of part for cars. Going to a hospital is a problem. So the problem is very complex because it's not only food, medication, everything is lacking in the country. And everybody is having difficulty in finding whatever they require. Food, for example, means long lines, and of course, you can only buy one day according to the last name of like your social insurance number. Then you have to have. And it depends on if it's your lucky day, you might be able to find something. And if not, you have to start asking friends and doing a little bit of the old trade, the old-fashioned way where you trade. Oh, I found 2 bags of flour. I'll exchange one for you for sugar. So that is the way. And there's certain things that they haven't seen anymore.
So when you talk to your mother, she's getting on in age. What particular kinds of issues has she had to face, and what kind of toll has it taken on her?
Well, for example, the typical thing is she can't really stand in line in a supermarket to wait for food for 4, 5, 6 hours. That's something she can't do. So there's certain things she just simply doesn't buy anymore. So she said, I haven't seen rice for a long time. And we're talking about something very basic in Venezuela, such as rice. She hasn't seen bread. So we had this, you can buy bread nearly every day. Well, she hasn't seen bread along. Medications, there's some medications she can't find and have to ask people to bring medication for her from some other places. So it's talking about soap. It's talking about taking shampoo. I was lucky. I had her visiting here, and she went with a suitcase full of soap, shampoo, basic needs that you will really, need for every day that you can't find.
It must be difficult for you just to think of what she and her other family members and friends are going through every day.
And when you hear someone like saying, I feel bad for these people. For example, she was telling me the other day she was in the pharmacy and there's a young lady like desperate, and she needed to buy some medication, but it wasn't her day to buy. So my mom would tell, okay, give me the money, I'll buy it for you. That is the way. She tells me it's so sad seeing people sitting in the street in front of a supermarket waiting to see if some of the food arrives and if they can afford it and buy it. That is, for her, it's been heartbreaking, and as for everybody, but, that's the way it goes.
Well, it must be so tough for society to just keep moving on when people are forced to stand in these lineups. What about the kids? I mean, are schools in session?
Schools are in session. However, for example, teachers at least miss 1 hour, 1 day a week because they have to queue up to buy food as well. A lot of kids can't go to schools because they haven't eaten anything. Schools can't give them food because there's no food. We're talking about the same thing about employees. Well, they miss a day at work because they have to go and line up for who knows how many hours to be able to buy the basic stuff. The other thing is the problem gets worse because if you compose into that, the problem with electricity and water, well, you are sometimes, what I was reading is someone is going to buy something, but then if you need to pay by credit or debit card, well, if there's no electricity, the internet doesn't work, then you've been waiting in line for probably 10 hours or 5 hours and you can't pay. And, there's no air conditioning and it's hot in some areas. So it's really the whole thing. This takes me again to hospitals, for example. You're in the hospital. Well, if there's no electricity, how can you take care of surgeries? How can you take care of patients who need to have a machine that runs on electricity, air conditioning for for operations? So this has gone all over, apart from medication. So the crisis is widespread, and it's amazing that you see a country such as Venezuela, used to be a rich country, that has completely failed, and it's a failed country. That's what's happening.
So who do people blame for this current situation?
Up to now, there's about 80% of people rejecting the president, the actual president. People say that it is the government's fault of not providing the food, having different policies that have not worked. And this is it has started slow. It started very slowly many, many years ago when Chavez was in power. Now, this has been made worse since the price of oil has dropped by 50% or more.
Incredibly oil dependent, of course.
And then you have the issue that a lot of expropriation of private enterprises, low price of oil, the public enterprises taking over. There's lack of production, low income of U.S. dollars. There's no money.
So you have Nicolas Maduro now, the socialist president, saying, "No, this isn't my fault at all. These are my opponents that are claiming this. They're creating these economic situations." What do you make of his response?
Well, the interesting thing is they have been in power, first Chavez, then Maduro. They have been in power for about 17 years. Well, can you imagine really that the opposition will have the strength of doing something like that if they don't control anything in the country? The thing is, it's very hard to recognize that it's a failed revolution, what they call the socialist revolution, the Chavismo. It has failed, and it's obvious, it's blatantly obvious for the people, but the government doesn't want to recognize it. And then it's very easy to blame fault in someone else. It's very difficult to say, it's my fault, we didn't do a proper job, because that means that the revolution hasn't worked. And they're not going to recognize it. And they have people that are dying, they're hungry, but they would not do that.
So what is happening here in the Metro Vancouver area right now to help?
Well, one of the issues that we have is that because the government doesn't recognize that there is a problem, they need to declare a state of emergency for charities and international organizations to help, but they haven't. So there have been lots of cases when people have gathered lots of long amount of goods to send to the country that they have not been able to enter. So what people are doing individually is they're sending family packages or parcels to their families with rice, flour, soap, deodorant, grains, coffee, sugar, to help them out during these times. Now, if you can think about it, it's very difficult to get to Venezuela, so sending it's very, very expensive. So I'm talking about $400, $500, $600 to send something for your family. So, and you have to help them because they're hungry. They don't have what they need.
Well, what needs to happen, Laura, to get the Venezuelans out of this crisis?
One of the things is, first of all, I think the first step is the guilty part should recognize what they've done. That means that the government should recognize this is not working. We need help, number one. Then there's a step of working out slowly. I think if we have the government accepting that, then we can get some international aid for the humanitarian crisis, meaning food delivery, medications delivered for the people. And then probably there's also just start slowly back to democratic economic measures, allowing for people to have their own business, access to the international markets, bring in more food. And the Venezuelan people have been asking for a recall referendum. They gathered the votes, and there have been step after step that the National Electoral Council has been stopping that. And it's something like the government is falling, but they don't want to recognize. And they're stopping every attempt that there is to just getting the country back to and there has been a lot of the Organization of American States has been calling, Amnesty International have been calling, a lot of international organizations have talked about this, and there's a need for probably a little bit of international help and even for discussions or kind of agreements on how to work a transition to improve what's going on.
Laura, thank you so much for telling us more about exactly what's going on down there. It sounds like an incredible situation. We wish you and your family well in the meantime. Thank you.
Thank you very much, and thank you for inviting me today.
That's Laura Aveledo. She's a Venezuelan expat, lives here in Metro Vancouver, and she's a member of a local group, Stand Up for Venezuela.